Welcome to our rapid review on serotonin norepinephrine reuptake inhibitors. This session is designed for nurse practitioner students and healthcare professionals seeking a high-yield understanding of serotonin norepinephrine reuptake inhibitors. Let's dive into the essentials with Dr. Favour Olekanma. Serotonin norepinephrine reuptake inhibitors, or serotonin norepinephrine reuptake inhibitors, block the reuptake of serotonin and norepinephrine, increasing their availability between nerve cells. This contrasts with selective serotonin reuptake inhibitors, which affect only serotonin. Understanding this mechanism is crucial for differentiating these medications in clinical practice. Let's explore major serotonin norepinephrine reuptake inhibitors: venlafaxine, Effexor, desvenlafaxine, Pristic, duloxetine, Cymbalta, levomilnacipran, Fetsima, and milnacipran, Savella. Understanding their unique characteristics is crucial for both board exams and clinical practice. Venlafaxine, known as Effexor, is used for major depressive disorder, generalized anxiety disorder, social anxiety, panic disorder, and hot flashes. Remember, V for venlafaxine, V for vasomotor. Monitor blood pressure due to norepinephrine effects at higher doses. Taper off gradually to avoid dizziness, nausea, anxiety, and brain zaps. Duloxetine, known as Cymbalta, is effective for both depression and pain, particularly neuropathic pain. It's beneficial for conditions like diabetic peripheral neuropathy, fibromyalgia, and chemo-induced neuropathy. Exercise caution in patients with significant liver disease, heavy alcohol use, or severe kidney impairment. Desvenlafaxine, known as Pristic, is the active metabolite of venlafaxine used for major depressive disorder. Monitor blood pressure and taper to avoid discontinuation symptoms. Levomilnacipran, or Fetsima, also treats major depressive disorder with a stronger norepinephrine effect. Watch for increased heart rate, blood pressure, urinary hesitation, and sweating. Milnacipran, known as Savella, is primarily used for fibromyalgia in the United States. It addresses widespread pain, fatigue, and sleep problems. Remember, when you think of serotonin norepinephrine reuptake inhibitor and fibromyalgia, think of milnacipran. Serotonin norepinephrine reuptake inhibitors treat mood disorders like major depressive disorder and anxiety, pain conditions such as neuropathic pain and fibromyalgia, and vasomotor symptoms like hot flashes. Venlafaxine is particularly noted for addressing vasomotor symptoms. Remember, serotonin norepinephrine reuptake inhibitors are associated with mood and pain management. Serotonin norepinephrine reuptake inhibitors can cause nausea, gastrointestinal upset, headache, sweating, and insomnia. They may also lead to sexual dysfunction and increased heart rate and blood pressure. Unlike selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors' norepinephrine component contributes to these cardiovascular effects. Remember, serotonin norepinephrine reuptake inhibitor equals serotonin, norepinephrine, and rising pressure. Serotonin syndrome is characterized by fever, agitation, and hyperreflexia. Symptoms include elevated body temperature, sweating, restlessness, anxiety, diarrhea, and exaggerated reflexes. It's crucial to avoid combining serotonin norepinephrine reuptake inhibitors with monoamine oxidase inhibitors and exercise caution with all serotonergic medications. Selective serotonin reuptake inhibitors target serotonin and are first line for depression and anxiety. Serotonin norepinephrine reuptake inhibitors target both serotonin and norepinephrine, useful when pain is present. Key drugs: venlafaxine for depression and vasomotor symptoms, duloxetine for depression and neuropathic pain, desvenlafaxine and levomilnacipran for major depressive disorder, milnacipran for fibromyalgia. Serotonin Norepinephrine Reuptake inhibitors increase serotonin and norepinephrine. For depression with diabetic neuropathic pain, use duloxetine. Venlafaxine is effective for hot flashes, depression, and anxiety. Milnacipran is used for fibromyalgia in the United States. Be cautious of serotonin syndrome. Avoid combining with monoamine oxidase inhibitors. Venlafaxine requires careful tapering to prevent withdrawal symptoms.